John Cruz is a health scientist with the Vision Health Initiative in the Division of Diabetes Translation at the Centers for Disease Control and Prevention. Dr. Cruz's expertise and research interests include vision impairment, aging, caregiving, disability, health disparities among people with disabilities, and aging with disabilities. Dr. Cruz will be discussing the CDC NACCD program on building eye and vision health capacity in states and communities. Dr. Cruz?
Well, it's a pleasure to be here with you guys today. I have to add my thank you to each of you who've contributed to the development of the NASM report. It is so dear to me, and I think it will have a legacy that will stand the test of time, and I think we're making a nice contribution to that today. For you who don't know, I represent 1/3 of the Vision Health Initiative. So Janan, so we're here in force. 2/3 of our program are here, and because you take this seriously. The one thing I want to say is I think that today we're really creating a fabulous inventory of ideas. There's a lot of, I'm supposed to know the field, and there's a lot of things that we've talked about today. So this is an important contribution, and I think keeping that archive is really important. So what I want to talk about today is an effort that we conducted at CDC, started about 2 years ago, to develop what we call state capacity. We've worked with states a little bit in the past, but not on an ongoing basis. So figure out how this works. Okay, wrong button. There we go. So we often talk about these 3 buckets, 3 domains that define vision and public health. And so we talk about surveillance, effectiveness, research, and programs. And we do that out of convenience because the work is so big that you have to segment it in some way. So we tend to use these 3 buckets. But when you start thinking about state programs, all of this gets merged all of a sudden. So you can't nicely separate out these topics because people are interested in everything in that community. So what I want to talk about 5 factors. So this is my core to this, and then the rest of this is going to be just illustrating these 5 examples. But I think there are 5 factors that are important to improving the capacity of vision and eye health in states and communities. And one of those has been raised 2 or 3 times today, and that is having a champion. Chris Malin uses the term backbone, so I like that term. But there has to be somebody who cares about this and who's willing to step up. And often that's not the case. Second step is to understand or estimate the burden. And certainly in states, you talk with states and say, well, my state is different. And every state is different. So we need data that are sufficiently granular to understand the circumstances of that state and that community. The third step is to engage stakeholders in some way, and that is, I just say, other people like us. I mean, we're all going through this conversion process. You have to have other people who understand that this is a problem and begin to be convinced that it is. And then the fourth step in this is to convene stakeholders, and that is, you want somebody else to own the problem. You don't want that to be one entity. It has to be a group that is addressing this. And then the fifth is to provide an intervention or do something. So let me kind of walk through our experience over the last 1.5 years. We put out a little bit of money with the National Association of Chronic Disease Directors and to build this state capacity. And so what we did, I think trying to be responsible, was we surveyed public health departments, only those chronic disease directors in every state health department, and we asked them, do you have any experience in working in vision? And do you have any interest in working with vision? 4 of them, 4 states responded in a positive way, that they had an interest, they had experience, and they had an interest in doing it. Now, I think part of the problem, frankly, was our sampling frame. We only asked chronic disease directors, so there are other entities in the states, but we weren't asking them. But whoever got that survey didn't know about other resources in the state. So only 4 people identified themselves. So we ended up funding 3 of them, Alabama, Nebraska, and Ohio, very different states with very different experiences. And we, my comment is a little leverage is a lot. We gave them $25,000 each. So it was a little bit of money, but a little can leverage a lot if you put it in the right hands. So the first need is to understand the magnitude of the problem, and you have to do that at the state, county, to have state and county level data, because that then informs or has to be in coordination with state community priorities. So we've done these maps, these state level maps that show the prevalence of vision impairment by county. So this is the map for Alabama. Well, we gave the map to Alabama, and then they used that map, that data, and then they overlaid that with the prevalence of diabetes and the high prevalence of vision impairment. So what you see is in this map from the back of the room, the darker the shade is the poorer the counties. The counties with red show a high prevalence of vision impairment, if I can read the code. The yellow dot is high prevalence vision impairment, and the red is high prevalence of diabetes. So vision impairment, diabetes, and poverty are not evenly distributed across that state. There are pockets of poverty, and those pockets of poverty also have high prevalence of these diseases. Then you could also overlay that map the eye care providers in this country, in this state. So think where they are. I mean, the ophthalmologists are in the metropolitan areas, and optometrists are scattered around. So it gives some sense of what they do with that data. Another state we were dealing with was Nebraska. And Nebraska is a really rural state. I mean, the western part of the state is frontier. So you need to have county level data for that state. One of the things they did, interestingly, in Nebraska is they used some of their money to implement the vision module of the BRFSS. So the second step is engaging stakeholders, and so I've immortalized Steve and Jeff in this slide. They both went to Alabama to present and get the stakeholders involved. Ohio does an annual aging summit, and Ohio has been very successful in bringing together multiple partners across various communities. And then in terms of developing an intervention, Ohio, and Ohio's not doing all this with our $25,000. They have a very robust program, and we're supplementing that. But in Ohio now, there's a program called A Matter of Balance that is a balance program. It's not a false prevention program for older people. And they're including across the state now a vision screening for all the people who are participating in A Matter of Balance and identifying vision problems there. And what a clever idea, very little cost. So in terms of developing a portfolio of state community-based interventions, those have to be cross-cutting within public health. So you deal with things like vision and falls prevention, vision and diabetes. They also have to be cross-cutting across the community. So you involve public agencies, private entities, and consumers. Where we fall short in all of this is a lack of evidence-based interventions that we can provide across the community. And I think it's important to recognize this range of visual capacity. We can improve vision and eye health by enhancing access and utilization of eye care. So we deal with kind of primary prevention. We can improve the health of people with or at risk of vision impairment by enhancing the capacity of the healthcare system. So getting vision included in federally qualified health centers is kind of a logical thing. And then we also have to address the needs of people who have lost vision. So we can do health promotion, we can reduce smoking, we can improve nutrition, we can improve exercise, and we can prevent injuries, namely falls and traumatic brain injury among people with vision impairment. And I made it before the red light. Thank you very much.